Round of applause for Dr Joanne McCormack. Oh, cool.
Thank you. So this is about redefining normal eating, because there is a program, if any of you are not doctors, you won't know about DAPHNE. So DAPHNE stands for Dose Adjustment for Normal Eating. So the idea behind DAPHNE was if you were on insulin, type 1, that you could eat what you wanted, that was brackets normal, and then you could adjust your insulin so that you got a normal blood sugar. But it didn't really work like that, unfortunately. So this is about 3 patients who came off insulin in really 2018-19. And one of them had been diabetic for 20 years. So this, to me, is not normal. So it's sandwiches and fruit for lunch. And that's Keith, one of our patrons. And he also went to one of these diabetes prevention meetings where they gave him bread and butter pudding. I don't call that normal. That's what happened to Keith's blood sugar after his sandwiches and fruit. And I just want to show this little video now, if that's okay. It's actually work that was done with a patient called Sarah by one of the nurses in the hair group, which I'll tell you about after.
I was 27 when I was first diagnosed with diabetes. I didn't understand what diabetes was. I injected insulin with every meal and at bedtime. My life then spiralled out of any form of control because I'd lost control. My life was run by the medication. I'd already got 1 child and we'd been trying for 13, 14 years to get pregnant again. The heartbreak every month to find out that you're not pregnant was devastating. The turning point was walking in, sitting down and being asked, what is it that you want?
I knew my job was to help Sarah to understand what was happening in her body, how diabetes was affecting her, how the treatments she was taking were affecting her, but probably most importantly, how the food was having an impact on all of that. Well, reduce your insulin straight away.
She made me feel like I was a person. I wasn't just another number, I wasn't just another diagnosis. I was somebody that was worth fighting to save.
We were going to do changes that would require Sarah doing a lot of this by herself or with a family, and it was really important to spend time so that she really understood this, so she felt empowered.
I changed the diet by reducing the potato intake, by reducing the pasta intake. I gave everybody a smaller dinner plate. As each week went on, the weight was coming off, and that then gave me the incentive to push it, to carry on.
I knew that Sarah wanted to get pregnant, but I was also aware that she had polycystic ovarian syndrome. I knew that if we could help Sarah to lower her insulin levels, there was a chance that she would be able to become pregnant.
Within 3 weeks, I'd lost the nighttime insulin. I no longer had the needle at bedtime. I think it was about 2-3 months in, I'd lost all medication completely. I didn't need it. I'd put my diabetes into remission. I've lost 9.5 stone. I've lost more weight than I actually weigh. The change in me to see my son smiling because mum's chasing him through a field. I'd never done that. It was about 8 months after I first started seeing Glynis that we found out I was pregnant. Peter was born in August 2017. We've then gone on to have Alfred. It is truly amazing. If you feel like I did, do what I've done. Glynis was there to push me along, and I shall be eternally grateful for her to doing that. But I had to change, and I had to realise that I wanted that.
From seeing somebody that was so sad to knowing her now with this beautiful family, she's living a life.
She made me feel like my life was worth living. And if it hadn't been for her, I don't know where I'd be now. You need somebody to be there and support you the way that Glynis supported me.
So I got permission from the nurse. This is publicly available. You can see it on YouTube, but I got permission from Glynis to show this. It's really fantastic. And we were all very impressed with it. And this is about giving people hope and helping them achieve their dreams. which is just fabulous. So I've actually done this in my groups. So I run small groups of between 6 and up to times it's been more like 20 people. And 2 people in those groups that I just wanted to feature. Shirley had been diabetic since the year 2000 and Robert since 2006. They were previously advised to eat normally, basing their meals on starchy carbohydrates or anything else they wanted. They were told they could have whatever they wanted and use insulin to cover. Straight to the results. So Shirley came off insulin after 6 years of Novamix. She was on 54 units BD. She was also on, can you hear me if I do it like this? Yeah. Can you hear me? Yeah. So she was also on painkillers, obviously testing strips, needles, metformin, omeprazole, statin, antidepressants. The cost saving and quality of life improvements were enormous. She's really happy now. She's got a 37% reduction in her HbA1c and she's lost 2.5 stone. She's really, really happy. Her major complaint was pain before. Now she feels great. Robert, I actually had really very little hope for Robert. Yeah, I'll have that in a minute. Thanks. I had very little hope for Robert because he had so many medical problems. He actually had cirrhosis and he had various other things. Like everybody seems to get, they accumulate more and more illnesses when they've got diabetes. But he halved his HbA1c and put his diabetes into remission after a month, which is just fabulous, absolutely fabulous. His GP was very impressed. I'm not his GP. His GP asked me to come down and do sessions in their practice. So I didn't even have a background, I didn't have a background relationship with this chap before. It was just wonderful. So that's Robert before. He gave me permission to use his photograph, and that's him after. He's really, really pleased. Now, Robert wants all doctors and nurses to know about this. That's why he agreed to come in this presentation. So what is normal? This that I found in the ground when I was walking along is not normal. I'm one of these people who can't bear to see rubbish on the ground. This is also not normal. This is something else. This is posh, not normal. And this I find beside them on the ground, which I think is what you have to take if you eat too many of them. It's ibuprofen. So we heard about one sort of crap. This is another sort of crap. So I thought I'd get somebody to read out this. Now, the first one is chemicals you don't use in your kitchen. So I wonder if I could ask borrow. Let's see. Borrow one of you just to read this out. Yep. Okay, Karen. There we go, if you want to just take this. Do you want to stand up here and just read out the ingredients list? This is actually a very healthy product that most people think is so healthy it's going to have you running a marathon. It's a really healthy product. If you just read it out, please, Karen, as fast as you like.
Wholemeal wheat flour, water, yeast, salt, vegetable oil, rapeseed, sustainable palm, wheat gluten, emulsifiers, E471, E481, E472E, soya flour, preservative, calcium propionate, flour treatment agent, ascorbic acid, vitamin C.
Thank you. You'll be reassured to know that it's approved by the Vegetarian Society. It's also halal approved and it's kosher. It's whole wheat bread. Oh. Now, this is also not normal, and this is a short, really, it was something I found written on a blog about whether something was safe to eat. So if somebody else could read this out, maybe you? That'd be all right?
Okay.
Yeah.
I was hungry, and the only bread available was Warburton's Toasty. Called up the customer helpline, and they said all their products are suitable for vegans, except the milk rolls, loaf, and assured me that none of the E numbers were animal-derived.
Thank you. So I don't think that's normal either, to eat that sort of food. So what I do in my groups is I have samples of real food, and I don't actually include lots of bad things like that. or loaves of bread. I actually just have real food and talk to them about what they can actually make with the real food. I also talk to them about avoiding artificial sweeteners, because a lot of them say, can I use sweeteners? I say, well, no, it's not really normal, but maybe you could wean yourself off with sweeteners, but I don't want you using them long term. So this, for me, is normal redefined. It grows in the ground, so it's cabbages and not Coca-Cola. It comes from an animal, it's cream and not ice cream. It's from the flesh of an animal, like meat, but not meat pie. Swims in the sea. Unprocessed, like kidney beans, not tin baked beans. And natural fats, not industrial ones. And a lot of patients really get this. Now, this is another thing. I think every diabetic deserves a normal blood glucose. I think it's on the Type 1 Grit site. I think Dr. Bernstein believes it. And I think that everybody should know what happens when they eat different foods. So although, say something like rice is a good example, because a lot of people think that is a fairly normal food. It grows in the ground. You could get brown rice, for instance. But if your blood glucose goes up to 15 after brown rice, it's not normal for you to eat it. It's best not to bother. And so I encourage all of them to check the blood glucose an hour to an hour and a half after they've eaten. Everyone buys a blood sugar meter, whether they've, even the people who are on just metformin, and they find out what happens. And this is just a little, I'm sure you've all heard of Richard Bernstein and about Virta. Certainly they've both been mentioned in the last 2 days. But it's really worthwhile looking at their videos on their website. Yeah, so that's really, it's just not normal to have a blood sugar that yo-yos all the time. And it's not normal to collect more and more symptoms and diseases. So Shirley and Robert collected between them things like acid reflux, depression, anxiety, chronic pain, cirrhosis, all manner of things. And they just felt really miserable. And when I spoke to them at first, you could imagine if you've had diabetes for 12 years and 19 years respectively, you think you know it all. You think your doctors and nurses have told you the truth and that there's nothing, you're doing everything that you can do. So when they first heard the different way of managing diabetes, they were a bit angry and they didn't really believe it. And they said, why should we believe you when we've been told different things by all these other clinicians over the last 19 years in Shirley's case. And I said, well, it's just come to light through technology that the previous advice was wrong. If it wasn't for technology, we wouldn't know. If we didn't have continuous blood glucose meters, if we didn't have the internet and finding out about organizations like DDM and other doctors, like I found Dr. Unwin in the internet and found out how to run groups, for instance. But I just don't think it's normal to live in ignorance about the effects of your diabetes. And I don't think it's normal to have no knowledge of which foods send your blood sugar up and which foods don't. And so this is the next thing. So I said to them, this is the core of my program. And if any of you are going to start a program and you've got resistance from local clinicians and they're saying, but we've already got a program to reduce diabetes, we refer into the local program, structured education program. So, well, this is a bit different because we're really going to concentrate on people's hopes and dreams here. And we're really going to try and get them to reduce the sugar. And there's nothing wrong with that. It's what we're, and not everybody wants to go to these other structured education programs. So I really do focus on what healthier means to you. So I just wanted to talk briefly about what people tell me. So Robert says, I feel healthier, I can bend down and do my laces, and I can get out more. And he also lost his weight, but he was much more interested in these other things. And Shirley said to all the group, she said, it's only 8 weeks of your life. The reason for that is I encourage them to start it and run the whole program over 8 weeks, and then they can keep coming if they want to. But she says, she feels healthier and happier. She's less meds and she's in less pain. But I thought it might be good to actually get people moving because it's just so so late in the day. And I thought I think if about 14 people could come, maybe from the edges, and just line up here. I've just got something to do. So maybe from the edges. And just come and line up, if you don't mind. I need just 14. Is this work? Yes, it's working. That's brilliant. That's great. So what I want you to do is one by one, just read out one of the things that the patient said to me about their hopes and dreams for a year from now. Just read out one at a time and then pass it on.
I'll be doing exercise for fun.
I'll be reducing my meds.
I will have less weight on my joints. I will be in less pain.
Yeah, okay. I will take less insulin or metformin, or even come off it.
I will be less breathless.
I will be walking better.
I've got it, no. I will be bending down further.
I will be able to play with my granddaughter on the floor and get up again afterwards, as long as she's not on top of me.
I will be catching my grandchildren when they run away.
I'll be going to Enfield and walking through the turnstiles without worrying that I will get stuck.
Yes, so I had somebody who hopefully went there if they were playing at home today, that she went there today.
I will go horse riding again. I can't ride a horse anyway.
Where are we? I haven't got my glasses on.
Oh, right.
I will have more energy.
Yeah. And
I will have better cholesterol, and I will have better routine with eating.
That's great. Thank you very much. Now, these are the things that people just... two of you can sit down, actually, because I don't need quite as many. These are the things people have said, because I've been doing this programme for 2 years now. So if you wouldn't mind just putting your finger by the one you've done as you pass it on, and then people can know. So if you just read it from the top.
I play walking rugby.
I am off all my medication.
I am off all my medication.
I've cancelled my knee operation and I have no more pain.
I no longer take insulin.
I no longer take metformin.
I am walking better and further.
I can bend down and get up again.
I can play with my grandchildren on the floor. Line one. Yeah. Oops.
I can catch my grandchildren when they run away.
I have gone to Anfield and walked through the turnstiles.
I am going horse riding again.
I have more energy.
That's right. And then other people say they get better cholesterol. 90% of people get better cholesterol than this. And one of the things that they do say is they have a better routine with eating. And they love their food even though it's different. So thank you very much for that. I just wanted to get people up and moving, really. Thank you. You'll notice that quite a few things they say are very simple things. They don't want anything fancy. They just want to be able to engage with normal life again. And it's quite humiliating to have to ask other people to do your shoelaces, for instance, and getting that action back again is really welcome. So basically they base their meals on meat or fish, dairy, eggs, or veggie protein. They put lots of veg on. They added in healthy fats and above ground vegetables. And they ate a low enough amount of daily carbs to keep the blood sugar between 4 and 7. So I know we've heard from Trudy today about their program, which had 20 grams a day. I aim for 30. That's what I teach them. And I give them that book you saw in the video, you know, the Carbs and Cals book. I ask them all to buy it or to get the app. And, if they're not low enough, they bring the carbs down a bit lower. That's it. And Shirley and Robert did it by themselves. They already knew how to adjust their insulin. They adjusted their insulin every day according to what they ate. So they knew how to do it much better than me. And they just titrated down as they reduced their carbs. And they did very frequent testing. At the beginning, I was very nervous, so I had them doing it roughly every 2 hours and overnight as well. But Robert only took a month to come off. Shirley took 3 months. There are other things that I think aren't normal that I point out to them as we go through the groups. One is it's just not normal to eat all the time, to snack every 2 hours. Somebody came up to me today and said she was a teacher in New Zealand, or had been, and that they were encouraged to feed the children about 5 times a day. And that is just not normal. It's not normal to destroy your microbiome with antibiotics or with junk food. And it's not normal to be stressed. So if people are stressed, then we have to address that. And I do a bit of mindfulness with them. We also do some work on habits and normal exercise. So I don't encourage them to say, go doing marathons when they weigh 15 stone. But I talk to them about doing chair-based exercise and about doing swimming. One of the things I do is family support. It's normal for people to work in communities. So that's why I think the group works, because it's another new little community. And I encourage them to bring their friends or family along with them as well. And we've got online support just by virtue of they can email me if they want to, but they virtually never do. I mean, I've been doing this for 2 years now. They will only email me, I find, to say, I'm still doing your program, it's been a year, it's great, I'm feeling fantastic, I'm off my medication, that sort of thing. They don't email me in a bothersome way. I don't know why that is, but they don't. And it's on the website, fatismyfriend.co.uk. I say change your eating in 8 weeks, but basically it's for life, really. And that's just a little summary of it. We've got one of the groups, so I run 2 groups. I did have 3. They seem to morph after a while, then things happen and I move on to a new venue. But one of the groups has got a WhatsApp group, and that is absolutely fantastic. So I'm going to start it with the other group as well, and they share recipes, they share their success stories. I get more updates actually through the WhatsApp group than I do through emails, because I think they just don't want to bother me by email. And that's me, Joanne McCormack, freelance GP. You can come and see my groups if you want, just email me. I have it depends on the month, but I have between 3 and 6 a month. And please do, if you're a doctor, or a professional allied to medicine, say a pharmacist, please do join our hair group. So that's how I got the video that Glynis produced, because Glynis is in our hair group. So hair stands for hyperinsulinemia and insulin resistance. And it's a way of doctors and other healthcare professionals studying all this thing about hyperinsulinemia. And that's it. So thank you very much.